All right, welcome back here on Live Impact News on WCNC Plus. I'm Nick Sertivant. Jeb is here in studio. We are right there at the bottom of the hour, almost bumping up against 1:30. So we want to get to an important story that our neighbor Beto has been on top of. So first week of school in Union County, and it comes with a huge victory when it comes to health and safety for students that suffer from this rare disorder. So Union County Public Schools now must ensure round-the-clock access to a potentially life-saving shot during the school day. Again, I told you that Nate Morabito has been on top of this story. We have Nate in studio. Nate, tell us more about it, because I was reading your story, and I guess my takeaway, like a lot of your stories, is wow, like this is happening.
Yeah, I mean, what's also wild about the job that I do is so much happens behind the scenes. Mm-hmm. So this is a story that I first did the interviews for, I think at the end of May, mm-hmm. right? We interviewed a couple families in Union County who have two kids. There's really three kids involved, honestly, between the two families that have this disorder called CAH, congenital adrenal hyperplasia. And essentially what can happen is if a kid has some kind of traumatic event, like they break their leg, mm-hmm. they can go into what's called adrenal crisis, and their body will start shutting down. Now, they're on maintenance medicine during the day, mm-hmm. but if you go into an adrenal crisis and you're at school, and let's say you're sick, and that's something else, right? And you're vomiting. You can't keep a stress dose down.
Yeah.
Like I can give you a stress dose by mouth, but if you can't swallow it, it's not going to save your life. So you have to have a steroid shot, which is fairly harmless normally, but this is like life-saving, this shot. And the problem is, in Union County, they are only allowing school nurses to give the shot if it's needed. And school nurses aren't at school every day.
Yeah.
So what happens if a kid goes into crisis at one of these schools, the nurse isn't there, the district says no one else, no trained teachers, no trained staff can give the shot. They have to wait for an ambulance to get to the hospital, and the risk of dying really increases substantially. So this is a basic right for a kid with a disability to be treated equally and not be discriminated against. So I don't know if you remember the early parts, because I feel like we've talked about this before, right? Like where these families were getting really emotional because there wasn't this backstop for their kids at school. Mm-hmm. And we did our initial story. We also found a couple school districts in North Carolina that allowed teachers and administrators to give this shot in an emergency if they were willing and trained. Mm-hmm. And we went back to Union County and said, well, we found these school districts that do it. You all won't do it, but you said that you're not sure that anybody else does it, but these two do it. They said, well, we'll reach out to them. In the meantime, school's getting closer and closer to starting again. And this one family, the Damato family, they live in Waxhaw, files what's called a due process hearing request. They want a hearing to basically express their concerns and give their side of the situation, and then like an independent hearing officer will decide if they're right or the school's right. So we knew that they had a hearing Friday. I was up in Buncombe County actually with our photographer working on some stories related to Helene, and I received this email Friday saying it was an exhausting hearing. You know, we don't really feel great about how it went necessarily. We just don't feel good that it's going to come and help us out here. And so Monday comes around, they send their kid to school, and they get the decision. And the decision finds that Union County Public Schools discriminated against this boy because they did not give him the safety backstop he needs at all times.
Yeah.
That they denied him a free, appropriate public education and equal access. So essentially, a kid that could get a bee sting and need a shot for that, he can get that shot by anybody at the school, but this kid can't. And what this hearing officer said, that if you're not going to let other trained employees give this shot, you have to make nurses available every day, all day long at school. So this was a huge victory for them initially. And I want you to hear from Dominic Damato, who was at work when he got the letter from the hearing officer. His wife called him and said, hey, let's read this together. They read it, he goes into a meeting, and eventually it hits him. Take a listen.
I was thinking such a quick response. That there was so much evidence. I mean, we had like a 62-page complaint, all the evidence and attachments and exhibits from both sides. It was a lot. So that hearing officer had to work all through the weekend, and to go through it right before that meeting, I'm like, wait, what? And it didn't really sink in until I had a 9 a.m. meeting. I was halfway through that meeting, and I'm like, oh my God, we won. That was awesome. It like totally in our favor. All 3 points were justified, and rightly so. I mean, it was a long road to hoe. It was a whole year worth of, trying to contact people to get information to help, proactively take care of the situation, with very little assistance until, we had to go the due process route just to get action, and that's fine. Hey, whatever it takes. I wish more parents would do that, honestly, because I'm sure there's other children, right, with medical conditions that could benefit from processes like what we've accomplished today.
They got some help from Disability Rights North Carolina with kind of going through that quasi-legal proceeding. In the hearing decision, the hearing officer cited our reporting in that, we found other school districts, and Union County was not as urgent in trying to find out if they can do it too, essentially. And what the hope from Dominic is that this will set a precedent for other families.
Mm-hmm.
I told you we interviewed multiple families.
Yeah.
I should tell you, number one, that Dominic's son Harrison has a little brother who has the same thing, who also has CAH. So he's eventually going to be in school in a couple of years. And if they hadn't had this change, he'd be in the same scenario. Well, this other boy, Oliver Piazza, I heard from his family. They were hopeful that this maybe will change his situation too. And I emailed the school district and said, what are you guys going to do overall? And they said, we're now putting nurses in every school full-time with any kid who's diagnosed with CAH. It's such a rare disorder, but it's the disorder that really life and death hang in the balance here.
Mm-hmm.
And there's now a safety net that's going to be put into place. And wow, I mean, it feels so good to know that these kids, these innocent kids that were just born this way,
Mm-hmm.
are now going to have that same access to the medication that will save their lives.
I'm thinking about the father who we just heard from. His name is Dominic, right?
That's right.
So I hear Dominic, and I think about what you tell me all the time is, you do these stories, but you got to take the extra step. And I know the extra step is hard, right? And that is filing the paperwork, going to the hearing, like doing the extra work, and it ends up, a lot of times benefiting you, not just you, but other families, other people affected. But again, you always put that context out there. People have things in their lives that are going on, so it impedes them from doing the extra step. But when they do that extra step, it does make a difference. That's just exactly what I thought about when I heard that.
Yeah, and over the last several years, I've done several stories on students with disabilities. And those parents especially, I'm so impressed by,
Mm-hmm.
because they feel like they've been screaming for years and nobody has listened or heard them.
Mm-hmm.
And these are people who have very stressful lives.
Yeah.
They're working,
Mm-hmm.
they're sending their kids to school, but they have this added additional challenge. And the only way to get results in these cases is to have parents who are relentless
Yeah.
and who are going to advocate for their kids and not take no for an answer. If that was some other family that wasn't going to put the work in that they just did, this result may not be the way it is today.
Yeah.
I certainly know, and Dominic has said as much, that our reporting substantially
Mm-hmm.
helped the cause there, proved that there has to be a solution. But if these parents don't go through the overwhelming effort to file this paperwork, to request a hearing,
Mm-hmm.
to get exhausted arguing their case, to over a year keep getting denied by a school district, by the way,
Mm-hmm.
over something that they think is so reasonable and common sense, if they don't put that work in, we're not here today. And so I gave them major credit then, and I still do today, for putting the effort in, because if they don't advocate for their kid, the sad thing is many others will.
Two-part question. Why was this such a struggle from the school district to change? And then two, anything on the state level that can be done to make it happen across the board? Because from what I'm hearing, it's by school district to make this decision.
Yeah, great question. Let me answer that one first, because that's on my to-do list. I mean, that's something this family has wanted. They want a state law that, explicitly says for this kind of shot, nurses can delegate to train staff and teachers. That's what they want to be a law. We're at a situation where the session really is not going to kick up where this can happen until next year,
Yeah.
right? So we'll look at what lawmakers are on the relevant committees and we'll reach out to them. That's on my to-do list because I think that you're right. Although this is rare, there are other kids out there,
Right.
number one. Number two, the school district initially told this family something that wasn't true. They said that, essentially the law prohibits nurses from doing this, from letting other people do it. That's not true. We proved that in our initial report.
Okay.
The State Department of Health said, nope, it's only up to the actual nurse. And for whatever reason, at this school district, they've taken an institutional approach on this of saying we weren't going to change anything. The thought is maybe they were afraid of the liability, but these families said, we'll sign liability waivers. First of all, there is no liability, but we'll sign a waiver even.
Just in case.
Yeah, just to let you know if you put it in wrong, no problem. We're not going to sue you. So there was a little bit of fear of that as well. And I think that what one of our biggest jobs, Nick, is just to educate and not to just let people say one thing and us take it for being the truth. We have to actually question it and be skeptical, and that's our most important job, is to be skeptical of what people say. And so I think there was a little bit of ignorance about what the law was. I think there was a lot of resistance, probably from the legality side of things. And I'm not sure they were convinced this family would be so willing to take it to the finish line.
They were banking, in a way, I don't want to put words in their mouth, but banking on it stopping at some point.
I mean, why else would you say this is our decision and this is what the decision's going to be? Now, they
you're
must
exactly
have believed
right,
in it.
yeah.
I try to give people the benefit of the doubt here,
Yeah.
too, right? Like, if that was their stance, that was their stance.
Yeah.
It doesn't mean it was the right stance, but that was their stance. This family was not going to accept that, and thank goodness, because they really had no choice. I mean, their kid's life is at stake here.
Yeah.
Their health is at risk every day. And I know a hearing officer forced their hand, but good to Union County for saying we're going to put a nurse in every school full-time that has a kid with CAH, diagnosed with CAH. The family still thinks that there needs to be more. They really think that the delegation aspect would be very helpful. Just think about, the nurse, I don't know, calls out sick or steps away or is helping some
Yeah.
other kid for 30
Yeah.
minutes. Then who's going to give the shot, right? That would give one more option. And it's, what are the chances of this happening? But I have talked to people in this world, the small knit community of CAH, who know of people that have died from this. And we want to be preventative. We don't want to react when it happens. We want to prevent it from happening. And I really think that this goes a long way in doing that and helping better protect these kids.
Yeah.
And something I love what Dominic told me. He goes, we've tried not to tell our son about this because we don't want him to worry, to think that there's some risk to him.
Yeah.
And he goes, now that this decision's been made, it means he never has to even know that there was a worry from his parents' perspective.
Wow.
So it's just this peace of mind, this exhale, and they still have to finalize the documentation. But honestly, to get this decision is such a credit to this family who's been so persistent in the name of just their kids' safety. And I'm just so grateful that they came to us in the first place and asked us to look into it. Because a lot of times when I'm trying to decide what stories we should do, I try to figure out, number one, is it life or death?
Yeah.
Check. Number two, are the people that are reaching out, are they putting a good faith effort to try and do this the right way and not just be, a quick news headline out there to rattle some cages? Check. They were trying to do this the right way. And three, can we make a difference here? This is unusual. There's some real gaps in this particular issue, at least in North Carolina. Can we make a difference? And the answer was yes, we did. And I'm just so grateful because if a parent doesn't email us in the first place, we're not in this position either.
Wow, such a powerful story. Oh man, Nate. Yeah, I feel like every time we have a conversation, we converse about your stories, man. I just walk away with something, and I hope you at home walk away with something out of this. And you can catch the story. Is it posted already on?
It's online at
it's online?
WCNC.com.
Okay.
It's going to air tonight at 6 on WCNC on TV. And you're going to see it all over our social media, too. And I think, just a reminder, this is the job for me.
Yeah.
This is what I should be doing,
Yeah.
is making impact And thankfully, we're given the time to do it, because without the time, told you this started at the end of May.
Yeah.
And the amount of phone calls I've made to people not just in North Carolina, the text messages I've sent, the research I've done behind the scenes has really been enormous, hoping that we would get to this point. And a lot of it is trying to figure out how can we get there, especially in a situation that's not political.
Yeah.
This is strictly
It's life or death.
life or death,
Yeah.
common sense. What can we do to protect these children? By failing to put a system in place that gives them round-the-clock protection, the hearing officer said the school district discriminated against this boy, and that's about to end.
Incredible work, Nate, as always. Again, you can catch Nate's story right now on our digital platforms and then on air here on WCNC Plus, WCNC Charlotte at 6 o'clock. Nate, thank you for your time, man.
Always love talking to
Incredible
you.
story again.